My health-related issues began at the age of 2 when I had a bloated belly and no obvious answer for why that was happening. It turns out that that was malnutrition from ingesting gluten and not being able to absorb the nutrients. The summer before my sophomore year of high school, things became more off than they normally were. I had digestive issues that would take me out of class for 30 to 40 minutes at a time, causing massive embarrassment for me. And I ended up missing about 30 days of school that year, which is almost enough to not even pass the 10th grade. The diagnosis came for me a month after my 16th birthday. After the initial shock of my diagnosis set in, I was angry. I was angry that I had to change my diet. I was angry at doctors. Some of them didn't believe me, and some of them just missed all of the warning signs. I had nobody to help me not only learn about the diet, but help me to channel my frustration in the amount of time that it took for me to get diagnosed. At school, all I wanted to do was eat pizza at lunch, eat hamburgers, and join in with my friends. And when I showed up with my brown paper bag of gluten-free goodies, people would ask me, "Is that edible? How could you eat that? That tastes disgusting." In embarrassment, I retreated and I stayed in the hallways and ate lunch by myself for the rest of sophomore year. After a while, I learned that this gluten-free diet really helped me. So I was able to hang out with friends more. I was able to eat foods and not feel sick after. I always think to myself, if I had been diagnosed a little bit earlier or had a little bit more help, that things would have been a little different. Maybe I wouldn't have had to eat my lunch alone in the hallways. What's so great about the program now is that we have a psychiatrist on our team to be able to help kids like me to learn how to deal with social isolation and awkward moments in the cafeteria when people are staring at you because what you're eating is different. And not only the social aspects, but learning about the gluten-free diet itself. Learning that it feels good to feel good. It also really helps to have someone who can help you navigate through all of these social experiences that totally change when you have celiac disease. Many relationships revolve around food, and I had to educate all of my friends. And so learning how to do this in a non-threatening way became very key for me. This way, kids don't have to go through what I went through and can have a normal teenage experience. Now, after a celiac diagnosis, it's much easier to live a normal life.
Living with a chronic illness that requires a lifelong commitment to a gluten-free diet can be difficult for individuals at any age, but is particularly true for kids. It can cause severe stress on patients and their families, social relationships, and can contribute to a child's sense of social alienation, low self-esteem, and even depression. In most cases, receiving support from a trained mental health provider or participating in a peer support group can help patients overcome these challenges and promote pathways to a happy, healthy, and fulfilling gluten-free lifestyle. That's why Children's National Health System and the Celiac Disease Foundation have partnered to bring you the Celiac Disease and Gluten-Related Conditions Psychological Health Training Program.
This continuing education program offers education to mental health providers about the importance of recognizing and managing celiac disease, treating its unique psychological challenges, and empowering patients to cope adaptively with chronic illness. For many patients, a diagnosis of celiac disease can be overwhelming and confusing as they learn about the lifelong changes needed to adhere to a gluten-free diet. Some of the goals of psychological intervention include helping patients attain a developmentally appropriate understanding of their condition and its treatment, providing assistance in accepting the diagnosis, and empowering them to cope adaptively with chronic illness.
There can be many barriers to getting families appropriate medical care. Some examples include fear of medical procedures, lack of knowledge about their condition, poor follow-up, difficulty with developing an open dialogue with their provider, and past negative experiences in medical settings. Addressing these difficulties and advising families on how to advocate effectively for their child's needs is crucially important.
Many social situations involve food, which can be a major source of stress for patients and their families. Our training program teaches providers how to help families better cope with and adapt to social situations. Additionally, the seminar will help providers connect their patients to important community resources and find great tasting gluten-free foods in their communities.
At the end of this training program, providers will be equipped to know how celiac disease and other gluten-related conditions are diagnosed and managed, understand the unique psychological and social challenges related to celiac disease and other gluten-related conditions, facilitate patients' adaptive coping with chronic illness, empower families to embrace the gluten-free diet through an exploration of gluten-free food products.
Register today for this free educational program at www.childrensmedicaleducation.org.